Hi, I am Denise Nicol-Bahil with Think Regeneration, and we are here today to talk about advancing food as medicine. Think Regeneration is an organization, a nonprofit that works with folks around the country. We are working to accelerate the regenerative food supply and work on projects that help to repair the soil, local food infrastructure, the ecosystem, and human health. We're here with FreshRx Oklahoma and MTIH, and going to hear a little bit from each of them.
Hi, everyone. I'm Erin Martin. I'm the director of FreshRx Oklahoma. FreshRx is a food as medicine program where doctors prescribe locally grown and regeneratively grown fruits and vegetables to people with type 2 diabetes to help them give them healthier ways of living, reduce their A1C number, and feel better in all sorts of ways and lose weight. And I linked up with Think Regeneration to really start connecting the dots from all the way from local regenerative agriculture to health outcomes. And people have been calling us from all over the country, wanting to do these programs, wanting farmers to be engaged in these programs and have a market for these programs. And so we're really excited to link up and be able to spread this message far and wide.
Hi, everybody. Sorry, I'm not on video. This is Dr. Nasha Winters, and I am the executive director of the Metabolic Terrain Institute of Health. And I am just like where Erin is all about bringing the food as medicine in the diabetes community. I'm doing that in the oncology community. We have a lot of overlap in this world. In fact, where we really shine is our desire to focus more on the terrain. That is, of course, the human, even more so than just the tumor. But that also implies that we need to focus on the terrain of the environment in which we're getting sick or ill, sickness from or health from. And so we get to help patients understand that their pharmacy starts at the end of the fork. And we have all types of ways that we can assess people's personal terrains and how it interfaces with the terrain of the world they live in. A lot of folks think it's really strange to bring medicine and farming together. But in my mind and in my experience, this is absolutely where it begins. So very much looking forward to what's getting ready to happen this fall. And I'd love for you to meet Janet Ottersberg, who is the Director of Education at the Metabolic Terrain Institute of Health.
Thank you, Nasha. I'm Janet and the Director of Education. And not only is my job to provide education for our practitioners and for advocates, but to bring people together and to help provide resources for our community and for our network. And I'm very excited about sharing this resource and this upcoming event with our community.
So why are we doing this and having these events, you might wonder? So we're having them in both Colorado and Oklahoma. There's this really big paradigm shift happening. A lot of people have been working and understanding that food heals the body in so many different ways for a really long time. But there's been a tidal wave happening where multiple states are starting to cover food as medicine as an insurance benefit. More of these programs are sourcing local food. We have this big regenerative movement in agriculture, understanding the impacts of that, not only on the human body, but on the environment and all these other incredible benefits. And so we have this opportunity to really link these things together, connecting everything from soil health to human health. That aging, longevity, quality of life really starts in the soil. And we've really depleted nutrient density in our food because of the way that we farmed, and then also from over processing food. And so we're really looking at how these farming practices create nutrient density and how that all the way down the spectrum helps someone's body heal themselves if they get everything they need. But if the food is depleted by the way that we farm, then even if people are eating healthy fruits and vegetables or seemingly healthy, it may not have a lot of nutrients in it. And so we really want to help healthcare professionals understand why certain food as medicine programs who are sourcing more ethically and consciously would be more efficient and effective for their patients. And then we also want to connect farmers and to healthcare professionals so that healthcare professionals can understand it from a farming aspect and really value sourcing, and then provide this whole new market for farmers. It's a market for the first time in a long time that values quality of food over quantity of food. And that's really kind of where a lot of our issues came from. We were trying to feed everyone, which was important for a lot of reasons, but we really deteriorated the quality of the food in that process. So regenerative agriculture restores that and can actually increase what we used to have like 100 years ago. And we want healthcare professionals and farmers to really understand each other, and then other stakeholders across the food and health system.
Amen on that, Erin. That is perfectly said. And I love that you brought up about, just this amazing movement that's happening. There's all this hubbub around regeneration. And of course, we're hearing it in the farming community, but we're also hearing it in the health community. There's entire conferences called regenerative medicine. There's entire fields that are out there, but there still is this strange disconnect between the farmer, between the medical provider. And one thing I think it's really interesting for the listeners here is that, do you realize that less than 25% of all medical schools even offer an elective course in nutrition? So when we wonder about that disconnect, that's where it begins. That's why having Janet here, our director of education, we aim to change that educational framework from the ground up. And specifically, let's talk about how this is translated over the past 150 years of sort of the post, industrial food revolution. Is we now today, based on two separate studies in 2018 and again in 2020, that last one wasn't published until 2022, which shows that less than 6.8% of Americans are considered metabolically healthy. So what does that translate to in the disease world? Well, Erin's been experiencing with it with the diabetes world, but that also means Alzheimer's, ADD, autism, cancer, cardiovascular disease, obesity, autoimmune conditions. All of these are conditions that are considered metabolic diseases. And so when we look at that, when you think about the fundamentals of metabolic disease, it's looking at your blood pressure, your lipids, it's looking at your insulin levels, it's looking at your hip to waist ratio. All of these really are deeply impacted by what is at the end of the fork. And so if we don't start to consider the foundation, the food as our foundation and the farm as our pharmacist first, we medical providers do not have enough pharmaceuticals in our repertoire to deal with the worsening health crises.
Right, absolutely. And so Denise, would you like to go into more about what kind of experts we'll be hearing about at these events and what kind of things they'll be talking about?
Yeah, absolutely. So we just got a little preview there from Dr. Nasha. Thank you for that. That was amazing. And I think just highlights exactly why we're doing this and why it's so important to bring farmers and healthcare professionals together. We're going to be hearing from a number of experts in farming, health, and nutrition across both events, including Dr. Nasha, Gwendolyn Lusk, who's with the Ratcliffe Community-Based Organization, which runs educational programs to help producers with sustainable farming practices. Gail Fuller is a farmer who also runs workshops on mental and physical health. Osray Wyckoff is going to lead us on a farm tour in Colorado and show us, on the ground, give us a look at the practices they are using there on their farm that lead to nutrition in our food, and also talk about some of the research that we're doing. When we're in Oklahoma and Tulsa, we're going to be touring two farms there with Rachel and Brent Summers and Katie Flohockey. Both of those folks in both of those farms are working with the FreshRx Oklahoma Food as Medicine program too, and feeding those patients there who have diabetes. And then we'll hear from Jonathan Lundgren, who's an agroecologist who's working on solutions for sustainable food systems and has an initiative he's working on right now called the 1,000 Farms Initiative, where they are gathering data from farms around the country to help study the benefits of regenerative agriculture and help the producers get the results that they need. And there's more to come.
This is such an important topic, and this event is so important for our community in particular, because we talk so much about the terrain of the body, and that the terrain of the body can only be healthy if it's living in a healthy terrain, so the terrain of the earth. And so talking about that connection between the terrain of the body and the terrain of the earth is so very important. And it has to go way beyond our community and making those connections with the other people on this earth that are working towards that.
That's huge. And I think we as medical care providers, whether we are medical doctors, whether we are allied healthcare professionals, we have to do better for our patients. We have to offer more than just to say, eat better, because that doesn't mean anything today. And so it's important for us as clinicians to literally get our continuing education, get our hands into the soil, get to know our farmers and our ranchers and those that nourish us, so that we can go back with the information required to educate and empower our patients to a different outcome.
And we really have to restore this, what I say is this synapse in the brain that has been totally disconnected from where our food comes from. It's so important to reconnect that. And we're really excited to see all these experts talk about this and come together and have all these different healthcare professionals really understand this. And even, you'd be surprised, even food as medicine programs all across the nation don't think about sourcing. And we want to make sure that we talk about all these different models and delivery systems of food as medicine that are going around all over the country, and really help them also understand why sourcing is not only important for the people they're serving, but how it's economically helpful and how it has this huge return on investment, both for someone's livelihood, their quality of life, but also our local economies and rural economies that have been totally really destroyed in so many ways. So Denise, tell us a little bit more details about when the event is, how to register, and you won't want to miss it, I promise. So try to come to either one.
We'll be in Colorado, September 11th and 12th in the Boulder-Longmont area, and then we'll be in Tulsa, Oklahoma, October 15th and 16th. And the event is free for farmers and ranchers. For everyone else, it's just $60 with their early bird pricing, which runs through July 31st. And after that, it'll go up to $75. So hope you can join us. We're looking forward to seeing everyone.
Very much looking forward to it.